Let's talk about IV therapy. As we work through this week, you will identify patients that need IV therapy, complications that might occur, and steps for care and maintenance of both your peripheral venous access device and IV fluids. Prior to starting an IV for your patient, a few things you need to think about is why. Why are they getting this IV? Is it simply so that I can give medication IV pushes? Do they need fluid management because they're dehydrated and I'm going to be giving them a lot of fluids? Are they getting blood products? Do they need to go for a CT with contrast? Is there imaging? Are there other exams? Are they going to have a procedure? Why? And the reasons for that will help us dictate what we need to look for and what size and IV we need to place for our patients. IV needle gauges. So they come in standard colors to the numbers, no matter which manufacturer you look at. The 22 is typically always going to be some kind of a light blue, the 20 gauge is a pink, and the 18 is a green. Now there are more gauge sizes, but these are the typical numbers you're going to see for IV catheters available within most of the hospitals. The 22 gauge is the smaller of these three, and the 18 is the biggest. 20 is kind of our medium, and that's where you'll see most patients will have, is the 20 gauge. With a 20 gauge IV, I can code my patient, I can give them fluids, they can get contrast, so pretty much everything we need. 22 gauge IV for most patients is going to be insufficient for anything other than an intermittent IV push medication. If you have a patient When choosing your vein, things to remember. You can use pretty much any vein on the arm. Now, there are going to be some things that will affect those veins. So if patient's really dehydrated, you're probably going to have a harder time to find that, to find a good juicy vein, which is really what you need. When you are feeling and palpating for a vein, you are not going to go crazy. You're going to literally take your finger, you're going to end up with a finger, you're going to find that finger. You're going to use it to gently push down on the skin, and you're looking for kind of a squishy type of feel where you kind of feel the empty space. You need to find a portion of that vein that is straight enough to get the tip of the needle into it. We will talk about it a little bit more in class as well, but try to find some veins on you or your spouse, your loved ones at home, just to kind of start getting a feel, because you are going to have to create your finger. You're going to have to train it to find those veins. Now, you are restricted to the arm. Okay, so anywhere on the arm, hand typically are where you can get both IVs and blood draws. Things you cannot do, you can't go there. So patients that have diabetes and they are on dialysis, or their kidney failure patients on dialysis, have AV fistulas. They're going to have something on their arm that's kind of bulgy. You can feel that Bruin thrill. That would be an arm you have to avoid completely. Not just the area. You cannot use that arm at all. You cannot use the arm to draw blood off of if they've had lymph node removal on that side. Typically, patients that may have had that are going to be patients that have had breast cancer and they've had mastectomies with lymph node removal. So if they had a right mastectomy, the right arm is off limits. You cannot use it. If they have a lot of bruising, edema, swelling, things like that, you cannot use that arm to get blood either. If they have an IV running, so they have an IV in their right arm, they have fluids running, you cannot use that arm. That's kind of the last case scenario. We use the other one first. If you can't find anything there, then you actually have to stop the IV fluids for at least 3 to 5 minutes before you can even use that arm. And that's, again, a last case scenario. So typically we don't use that arm. In order to start an IV, you're going to need several things. One, you're going to need your IV catheter. You're going to need your extension set. You're going to need a flush, maybe a couple flushes. You're going to need your IV start kit. In the IV start kit, if they don't have them at your facility, there is a clear Tegaderm dressing. There is tape. There is a tourniquet, a ChloraPrep, and typically some gauze as well. When doing an IV, remember, pretty much the same as everything we ever do. Anytime you come in the room to do anything with your patient, you are going to identify yourself. You're going to wash your hands. You're going to put your gloves on. You are going to explain the procedure to your patient, and you do have to get permission from them. IVs. So your first thing you're going to do when you've gotten permission, you're getting ready to start all of that, actually start the procedure. You want to make sure before you walk in the room you've got all the supplies you need. Your IV start kit. In that IV start kit, we have, so if your facility does not have a start kit, you're going to have to grab these supplies separately. You have a Tegaderm transparent dressing. You have some gauze to clean up in case you make a little bit of a mess. You have tape. You have your ChloraPrep. You have a tourniquet, which we already have underneath our patient. You have a little sticker to date and time your IV. You will want to make sure you have typically a couple needles just in case. You also want a J-loop. This is one of those things we are going to tell you it's an extension piece. You're going to reuse that during skills. We only have so many of them for you, so make sure you save them, because you're going to need it. It comes in its own separate package, okay? When you're opening this, you want to be very careful when you're getting this set up. You want to be very careful. The top of this, that is clean and sterile right now. The inside of the package is sterile. You don't want to touch that. That's a contamination point. You will need to open up your saline flush. You can, as long as you pulled the flush out of a sterile package, now you can attach this to your J-loop. You're going to actually want to flush that so that there is saline in the whole entire line. That can be put aside. When you find your patient's vein, and take some time feeling for veins, you want to feel that nice squishy. Once you've found it, with an IV, this is one of the big differences when we're talking about IVs versus phlebotomy. Typically speaking, phlebotomy, most facilities will allow you to use an alcohol wipe instead of the ChloraPrep. Always double check your policies though. But with an IV, it's in much longer, and it's an area now where we're going to expose our patient to potential infection. You're going to use the little ChloraPrep, so you're going to have to squeeze it. So if you've never done that before, you're going to squeeze it, and you got to actually squeeze pretty good. You're going to hear the pop, and then it's going to actually start to go into your little spongy area. And then you're going to scrub, scrub, scrub. Just like with our alcohol wipe, you want to make sure you scrub plenty of time. You're going to give yourself a nice area of clean. One thing that's very different from blood draw to IV, you have to make sure you have enough of a vein, so it's got to be straight for about an inch or two to make sure you can get the catheter into their vessel. Once you find that vessel, we're going to clean that. This one's a little harder. You can't really lay it on your patient's arm, so make sure you're paying attention for any markers so you know where that vein is, because you cannot touch your vein, even with your gloved hands, after you have cleaned it. Where you're going to stick has to stay clean and sterile. So while that's drying, that's typically when I say go ahead and put your J-loop together. You're going to get your tape together. Now the tape pieces, you're going to want a good like 3 or 4 inches, and you're going to want a couple of them. Typically speaking, you're going to see the nurses in the hospital use the side rail, the side of the bed. You want to make sure it's somewhere that's clean for your tape pieces, because they're going to go next to your patient. You want about 2 or 3 of them, because we're going to use that to secure the IV to our patient. You're going to pick your size of IV catheter. So also remember, why is the patient getting an IV? Will also determine what size you need to use. Once that's all dry, you have all of your equipment, everything near you where you can reach it, even if that means taking their bedside table, cleaning it off, and commandeering it so that you have everything close to you. That's what we do. You're going to turn that tourniquet back on, so tie it again. Everything is where you can reach it. And you're going to get practice in a bed, because that's where you have to actually do it. You're going to pull your IV catheter out. Now you want to look at your IV catheter. All of them are a little different, so you will have to look at them before you go in. This one has a little thing on the top so I can push it to advance it forward. That little thing on the top though too also tells me that's my bevel up. You do want to double check the bevel, make sure there's no burrs or anything. This little chamber here is where it's what we call the flash chamber. So when you actually get into the vein, you're going to get a flash of the blood. So you know you're in, because you really only need to get this catheter just in enough so that the tip of that needle is in and enough of that plastic catheter is in so you can push the rest of the catheter. We're not actually putting this entire needle into the patient's vessel. You're going to grab the patient's arm, squeeze it. You're going to use your thumb below where you're going to actually start your IV insertion, pull down and anchor that vein, and then you're going to poke. So once you get that vein in, you get your flash. Now you are going to thread your catheter up. Okay. Now we have to be very careful here, because you cannot touch your insertion site. So now you're going to have to move your hand. We'll see if we can see this. Grab the very tip of this. Don't pull the needle out until you are ready to switch your site. You want to get that off without touching it. You're going to pull your IV needle out. Screw this on without touching the site. And then you will flush. And I'm in the vein. My flush came out my needle. You're going to take your first piece of tape. I like to flush before so that I know that I'm in the vein and we're not up against a vessel. Put that first piece of tape over the end of where it screws in, and your catheter, it just can't touch the catheter entry site. Put your clear dressing on. With IV, it's all about keeping those things sterile that are sterile. You are going to use clean gloves. So you don't want to touch this end of the J-loop, that end of your IV catheter. You don't want to touch this end with anything. You want to make sure that you have enough of the dressing to cover both your IV catheter and where it secures, and enough here so that this doesn't start to roll up and then contaminate your IV site. The other thing you have to do is secure your J-loop, because you don't want this thing flopping around all over the place, because if it's flopping around, it may actually get caught on something and pull that IV out that you did. So you want to secure that. Where you tape this now at this point is good. It's fine, because you have a clear dressing over this, so you can put the tape on top. You do want to make sure you have a little bit of wiggle, and you can get to your lock. so that you can, if you needed to come in and put a fluid bag on this, you could do that. Now after this, we're gonna have to clean this every time we access it, but you want a little wiggle there. You're also gonna date and time with your initials, the size of the gauge, and your usually date, time, and initials is adequate on an IV. So nice and secured, no contamination. A lot of it's practicing the steps and where do you get this and using your hands to do one thing. It looked kind of easy probably when I was doing it, but I've been doing it for a little bit, so you got to practice those things. When starting an IV, several things can happen. Patients can feel pain or numbness or tingling during the insertion. So when you put that needle in, if they start complaining of any of that, you need to stop. Typically that means you're too close to a nerve, and if continued, you can damage that nerve and they can have some long-lasting consequences. Other thing you can see is when you get that IV in, you're actually starting to do that flush. It won't flush. It's hard. But everything looked fine when you put it in. It could mean that you're up against a valve. If you just back the catheter back just a smidge and then flush, sometimes that'll work, and then you'll be able to flush the IV. If the site starts swelling up during the flush, that means you actually probably went through the vein and are out the other side, and you're now pushing saline into the patient's subcutaneous tissues. Not a good IV. You got to take that one out and completely restart. Other things you can see are hematoma formations. Typically when that happens, it's when you insert the needle into the vein and you hit that vein, and then all of a sudden it's like a balloon, it bursts and you get all that blood and the hematoma forming. Typically when that happens, it's a pressure issue and you've got the tourniquet on too tight, or that patient just can't tolerate the tourniquet and that much pressure. So you'll have to adjust the amount of pressure on the vein when you're starting the IV. Once you have the IV in place, it's very important to monitor that IV. Hand hygiene is always, always, always important before touching the IV, so clean your hands before and after. Typically, you're also going to wear gloves before you check that IV site. Things you're going to look for hourly are signs of complications. So redness, swelling, edema, does it hurt when you flush? You also are to flush the IV to maintain its patency. So we don't want any clots building up on the end of the IV catheter that's inside the patient's vessel. Typically speaking, most facilities, their protocol is every 4 hours, but you have to look at that per protocol for the facility, how often you have to flush. Minimally though, every 4-hour checks on your patient's IV. If it's running, you're going to want to check it hourly. So you have to check that IV site hourly if it's an active use. If it is not in active use, meaning there is no fluids going through it, you can revert to the every 4 hours. Dressings are to be changed every 5 to 7 days or as needed. So when you are doing your documentation for your IV, things you're going to always want to address are that the site was clean, dry, and intact, so that dressing was good. The site was without redness, swelling, or edema, and no pain. Common nursing diagnoses with patients that have IVs in place include deficient fluid volume because they're dehydrated. So that's actually why we're starting the IV. So it's an intervention for that nursing diagnosis. Risk for infection due to the IV being in place, as well as impaired skin integrity. When you are first doing your documentation for your IV, you'll go to your assessments, then go to vascular access, and initially there won't be anything on the screen, so you'll have to add a new site, and then you'll have to fill in all of the information about that IV. So right forearm, so what location, when you inserted it, the size, your description, any notes. And then when you're coming back to reassess, so maybe it's been a couple hours and you did a flush and assessment, you would use the reassess button on the actions. Complications and things to watch for when you're monitoring for an IV. course, infiltration. Infiltration can happen when you are starting the IV or during any time during the therapy. Typically, you're going to see swelling, might have some coolness. They may complain of pain. If this happens, you have to DC the IV and restart it in a new location. Infections, you've created a hole into the patient's body, skin, so we've given an area for access. Typical signs and symptoms of infection: edema, redness, irritation, fever, chills, anything like that. If this happens, we do have to typically DC the IV. Sometimes they'll ask for a culture of the site, especially if there's other issues going on, so you always want to let the doctor know first. Phlebitis is one of the most common issues. Typically, you'll see tenderness, redness, warmth, maybe some edema, but typically that redness is what you see to begin with. We are going to start the IV, or you're going to have to DC the IV and restart it. You can use warm compresses on the area that was affected because it can be a little painful. Avoid using that vein for anything else, so even going further up, because now we've got irritation of that vein. Typically, phlebitis happens when you haven't secured the device very well and that catheter is irritating the inside. So every time the catheter moves inside of the eye of the vessel, you're going to increase your risk and chances of phlebitis. So securing that IV catheter is very important. Of course, fluid overload. If you're giving your patients lots of fluids, this isn't really a complication that happens at the site of the IV, but more total body. If you think about your heart failure patients, or any patient, because any patient is there, if we overload them with fluid, you're going to end up seeing some edema. You may have dyspnea because we're starting to put fluids into their lungs, engorged neck veins. Their blood pressure might go up. So we have to slow that IV down, talk to the provider. Sometimes they'll DC it. It really depends on why the patient's getting fluids and what they can do with that. But we have to watch that very closely in those patients.